Okay. Okay.
Okay. Now, put your feet flat down first, your legs flat. That's it. I want you to just lay there.
See, already.
See, immediately, exactly. All right. You don't even have to generate energy. God, I wish I had all that energy. Okay. So that's so tight for your belly and it's so difficult. You can do one of two things. So let's try both. One is bend your knees up with your feet flat. Now, when that pull happens, go all the ways up so that your head goes between your knees. All the ways. That's it. Now, that's it. Stay there. And let's see if that pulsation moves in a different manner in your body, and you just let it happen. Take a nice breath for yourself. There you go. Now it's twisting you to your right. Now deliberately twist yourself to your left, like it was doing to you. That's it. Then come back to center, go left again. That's it. We're trying to create a dialogue between left and right side here. Okay, good. That's it. Now it's pulling you to the left. Is that correct?
A little bit, yeah.
Okay. So, all right. Now you pull yourself to the right. Remember, you're working with the organism. Okay. So we're trying to see what it's doing. And then we're trying to show that we're working with it. Good. Now come back to middle. And let's see what it does. That's it. See, we're looking for that. That's the dialogue between left and right side. All right. Way to go. And that's the dialogue forwards and backwards. You still okay?
Mm-hmm. Good, yeah.
Okay. That's it. Let your breath happen with that, because that's a tough position to be in. Go ahead, fall over if you need to. It's all right. Look at that, strong. Notice what it's pulling. What's it pulling on the left side or right side?
Whole shoulder across.
Yeah, okay. So take your fingers, your right hand, and scrape them really deep along that shoulder area. Like really deep inside. That's it. Scrape that. Good. Okay, now do the same thing with the other shoulder. That's it. Scrape it really hard, really deep, because your body's showing you it's tight. It's got to get out of that. And so scraping it is just trying to help it along. But it seems equally tight on both sides, actually. So that's a good thing.
My shoulders are very tight, yeah.
Yeah. Okay, good. So go ahead and lay down on the mat again. Can you, all right, so I saw you in your last video. Take your shoulders and pull them in towards your middle of your chest.
Like this?
Yeah, and then drop them. We're trying to bring some of that movement up to your shoulders. And get it out of your abs a little bit. There we go. All right, good. I'm just trying to move it around a little bit so it's not so exhausting for your abdominal muscles. Collectively, Mike, all of this is going to help release your diaphragm. There you go. Look at that right shoulder. Wow. See, there's the right shoulder connecting down into the left hip is what it's doing there. Now move that left shoulder the same way the right shoulder is moving. That's it. You're very good at that. So your body responds to you pretty well. That's it. We're just going to let that right shoulder do its thing. See, it's going down to your left leg. If that rolls you over to your side, go ahead and follow that. But that's really shoulder stuff. Oh, there you go. There's a nice dialogue. That's a release right there. That's it. Let it go down your hands and down your legs. Good for you. See, it's releasing the tightness, but there's so much energy in it, now distributes it through the body. Now, this is really great. It's going down your whole right side. Because if you have a right shoulder tightness, that means the whole right side is going to be tight. There's your hips. You're pretty easy. I could drink a cup of tea and just watch this. I mean, there's not much to do here. You're doing great, though. Is this all right for you?
Yeah, fine. Yeah, it feels good. Yeah.
That's it. Let it go down your legs. Good job. So it went from shoulders, right side, hips, down the legs. Tells me see, you have energy in all parts of those bodies. They're just not connected. And so when it releases tightness, it's starting to connect all the different parts. It goes right up to your neck. That's absolutely common. Good for you. Okay. Now there it goes. See, it's completed a cycle. Now it's starting all over again. But we'll try something new. We'll do a new intervention. Can you lay on your belly?
Yep.
That's it. And can you put your hands at your side? That's it. Let it do that. And just keep your breath with this, Mike. That's it. Let it do that. Perfect. Good for you. This is all loosening your hips and the psoas muscle in the hips. It's going to roll you again. Follow the roll. That's fine. So you have tightness both in the muscles going vertically and horizontally in your structure. That's it. Follow the roll. Follow that fetal response. You okay with it, Mike?
Yeah, all good.
Okay. Yep, follow that. That's it. See, it's going to try to stretch its way out of that. This is something you experienced somewhere in your life. If you need to stop and take a break, you do that for sure.
Right, it's good.
And just go for it. You're trying to get out of something tight. That's it. Use that wall. That's it. Good. That's it. That's great. Look how your body starts to relax a little bit. It got out of that, or partially out of that pattern it was in. And it's like, oh, thank God that's gone. That's it. Follow the movement, Mike. Your body isn't making a mistake. We just don't always understand why it's doing this. That's it. Follow it, whatever you have to do.
That's great.
Yeah, look at the stretch in the hamstrings there, the back, the calf
Always
muscle.
tight
Yeah. That's it. There you go. Good. Let that happen. That's a nice release right there. A little bit of sound with that, Mike. Just, that's it. Oh yeah, your hamstrings are loosening nicely. I can already see it. That's it. Just rest there for a minute. That's a lot of work for your body. That's it. See there, it automatically wants to stretch itself to get out of that tight contraction. Good for you, Mike. Where's that happening now? What's going on?
It feels like it's here's the problem.
Uh-huh.
Lower.
Yeah, and then the glutes. Yeah. Good job. Good job. There's the collapse. That's quite beautiful, actually, because your body is more solidly on the floor than when you started. It's like flatter.
Ah. Yeah, just there's so much energy here.
Yeah, yeah. That's from that holding in your belly for all those years and contracting your diaphragm.
Yeah. But it's less. It feels more.
Yeah, it's certainly going to get less and less and less, just that you have to do it for a long time because you've been holding it for a long time. So it's going to take a while for it to come out. How was it laying on your belly?
Yeah, interesting. Yeah, it was getting me to pulsate, but it felt more safer.
Yep, good. Perfect description. It is safer to be on the belly because then the belly and the groin are not exposed. See, there's the extension. And the collapse. Perfect. Yeah, see, that's slowly coming out.
Yeah.
That tightness is slowly starting to let go because it's being given sort of the ability to just move itself, which obviously it knows how to do because it knows how to get out of this tightness.
That's my dog.
Yeah, it's okay. Is that your right hip?
Yeah.
Yep. Just notice where it is.
Yeah.
But see, we could never have guessed this is what needs to happen next. This is what's great about TRE is the body knows how to get out of its tightness. It just needs us to give it permission to go ahead and move however it needs to. And you're really good at that, Mike, letting it move without any type of judgment.
Yeah, it feels really like a lot of energy there.
Yeah. Well, that's great. Wow. You're a whole study in anatomy. Just showing this video to trainees is huge. See the right hip, and then we're starting to go into your left shoulder.
Yeah.
And there's a crossover fascia pattern that does that. Your body knows it quite well. Twisting your arm, it's unwinding you. That's it. There you go. Right from your right foot all the way up to your left arm. That's it.
That feels good.
Yeah, all that stretching feels wonderful. Do you know how much your fascia is stretching out in these positions, and even your muscle patterns? You're finally coming out of that state that you trained yourself to be in.
Down the left arm, it feels amazing.
Yeah, great.
Oh.
That's it. Once it releases, Mike, it's going to let go. And you'll go into that little collapse thing. So you can just hang out there until it lets go. That's it. There you go. Yeah, she goes back into the fetal response. It's going to get some more of that tightness and then try to release it and extend the body again. Good job, Mike. You follow your body well.
I think this is like releasing the neck now.
Where is it releasing now?
Oh, what?
Your neck, the back of your head.
Yeah.
Great. There's a fascia pattern that goes up there, goes all the way down to your toes, actually.
Oh.
Wow.
Yeah, I feel better.
Yeah, I think that's enough.
Yeah.
Because it did so much that now it needs integration.
Sure.
And integration means just sort of relaxing and let it be without digging in to try to get more. See, because what you just went through was like 5 sessions.
Yeah.
It was a lot. But what I loved about it, Mike, is you were so free to let it happen. And you were so connected to it. That's what living inside your organism is that you're connected to its own pulsation and you let it pulsate the way it needs to without any type of judgment or condemnation or inhibition. Now, other people watching this could be terrified and say, oh my God, I don't want that to happen to my body. You're so integrated. You're so comfortable with yourself. You're so determined for this self-exploration that you're giving your body complete freedom to say, go ahead and move how you need to. I'm going to follow you as best I can. I'm going to let you take the lead now.
Yes.
And that's what we just saw.
It's so good. I feel so much more relaxed. I feel like I've had like a massage, like a really good massage. Yeah.
Yes, absolutely.
And just and like the tension in my shoulders is still there, but it's like reduced like 60-70%. It's like a lot less.
That's huge. Now, are you going to add this to your
Yeah, all of it. Yeah.
Okay. So you should maybe edit the amount of movement, but definitely, and that's what I wanted to ask you. What was the result of all of that? And you just started to describe it.
Yeah.
Describe it again in a little bit more detail.
Sure.
What did that feel like?
So the process itself, I just get out my own way. That's the best way I can describe it. I just let it happen. And you sometimes question yourself to go, am I doing this? Am I choosing to do this, or is my body doing it? And then you kind of just go, just doesn't matter, just let it happen. But then what I would say is like my overall like background stress levels dropped from like a 7 to a 4 out of 10. And all the tension in my shoulders has dropped. And although my body is tired, it does feel really good. Like I say, it feels like a deep tissue massage in my because I've got tight thighs, tight back, tight shoulders. And I guess the message I'm hearing is just do this every day, man. It doesn't take long. You should be doing this all the time. It's like it's available for you. So I'm really excited to see what this looks like after a couple of weeks, because for some reason I decided to hold off after our last conversation when I should have just been doing it every day. And I was like, no, I'll wait. But yeah, I feel like someone's got into me here with a really good massage and opened me all up. I feel like I've got more range of movement here as well now, which is nice. So
it's so fascinating. You are actually verbalizing, describing exactly what we just saw. And the combination of those two. And when you sat up and you said, this feels amazing,
yeah,
it helps people who are visually going to be seeing this to actually feel comfortable to say, wow, he went through all of that and he feels good at the end of that.
yeah.
So it challenges them to say, wait, maybe I need to go into my body and go past the fear that I might have about letting go to see what my body can show you that's bringing me to life.
Yes. Yeah. And if you tried this with me a year ago, it would have been, I think, a different story. But my journey of like playing with it, seeing you, my friend, doing it, then watching those videos the other day, the videos you sent me, which we can link for people as well, because they're all on YouTube, it almost gave me a bit more permission to jump into the method.
Very good. I agree. That's the only reason I put all those YouTube videos up there, is to show people this is normal all over the world. But what I love about it is every human organism moves differently according to the history it's been through. It's that simple. And what I loved about what you did was saying that if you'd done this a year ago, I might not have been ready for it. And I say that to everybody. They can watch you. This could be great for them. But if they have to say, if they still say, I'm not ready for that, I want them to respect that as well, but keep it in the back of their mind that maybe sometime in the future, this might be something that would be extremely valuable for them to try.
Yeah, beautiful. I'm so glad I found it. I'm so glad I found you. And it just feels like just a wonderful modality to add to my breath work and everything else.
Yeah.
It just feels like I'm always finding the missing parts, like we spoke about the earthing earlier, the breath work, getting daylight, sauna, and this just feels like a wonderful tool for that toolkit. Yeah.
How old are you, Mike?
40.
40. Okay, so think of it like this, because I'm 70, so I'm a few years before you. But like all the ways up to those like 25 and 30 is when we're being formed by society, etc. But once we hit around 30 or 35, is we really actually have a shift, inside of us where we say, wait, I've got to become me. That's different from whom I was formed to be. I'm going to become me. And that goes from about 30 or 35 all the way up to about 50 or 60, where you learn to re-inhabit yourself, your individual uniqueness, not how society has trained you to be. And that's when you come really alive to who you are. And that process of coming alive is your contribution to all of us, to say, watch me come alive.
Yeah.
It's my journey, but watch it, because it has something to do with both other people's journeys as well as I'm excited. I want to be around people like you who are challenging themselves to come alive. And like you said at the beginning, I'm mesmerized from the second your body moves itself, because it's like it's showing us how it can restore even the worst of traumas we've had in our life. This organism can just recover again and move on with life with great freedom.
And honestly, I'm so grateful for your time. And please, if there's anything else I can do or my channel can do to support your work, please just ask. I'm here to serve.
You are wonderful, Mike. I had a ball. That was a lot of fun.
Me too.
I enjoyed it immensely.
Yeah, brilliant. All right. Well, until next time,
Okay.
Thank you so much. Take care.
You're very welcome. Thanks, Mike.
Thank
Bye-bye.
you. Bye.